And other issues. Please welcome Dr. Arlene Bierman.
Thank you. I'm a member of the Ontario Health Quality Council, and the Ontario Health Quality Council is an independent agency mandated to report to the public on the state of Ontario's health system and also to support efforts to improve the quality of health care provided to Ontarians. We aim to be a constructive and positive force for change to make our health system better. Our most recent report was released in May, and in this report, we included a number of indicators that assess the quality of medication management in the province. First, we looked at whether people with diabetes and heart disease were receiving the recommended drugs that could improve their health and prevent complications from these diseases. We found much room for improvement. For example, only half of the people who had diabetes were receiving ACE inhibitors, a drug that can prevent the risk of kidney disease. Only about 2/3 of people with coronary artery disease or heart disease were receiving drugs, beta blockers and statins that could prevent heart attacks or early death. In fact, we estimated that by making sure that all who could benefit from these drugs received them, we could prevent 8,000 deaths a year.
Thanks for the opportunity to participate today. The insurance industry certainly has a vested interest in the drug market. We tend to cover the cost of medication for those individuals that aren't covered by public plans, or perhaps to cover their co-payments under public plans. In 2007, the industry in aggregate paid about $7 billion in drugs across Canada. So we do have a large place to play. Bill 102, directed mainly at the Ontario Drug Benefit Plan, did have an impact on private plans. Prior to Bill 102, the price of drugs listed on the ODB formulary was regulated, and all buyers in Ontario could purchase listed drugs at the same price as the ODB plan. There was some variation based on dispensing fees by pharmacy. That all changed with Bill 102. The clause that had regulated pricing was removed and has resulted in a two-tier pricing market in Ontario, one price for the public plan and another price for private payers. For the private payers, our concern was that prices for generic drugs in particular could rise in the private market to offset the loss in revenue from either manufacturers or pharmacists.
Carol?
Thank you. Cancer Care Ontario is the provincial cancer agency and the government's principal advisor on cancer matters, and our role is to improve cancer services every step of the way. Now, drugs is an important part of that. We're all here today because we all realize that there's a need to rigorously evaluate new drugs for their suitability for inclusion in public formularies, and cancer really is a very, very big part of that. I'll just give you a couple of numbers. Cancer prevalence has increased significantly. There's about a 40% growth in the number of people living with cancer today, in part because of aging and population growth, but more importantly because of improved survival of people who do get cancer. Why do they survive longer? Earlier stages of diagnosis, but they are the beneficiaries of significant advances in drug treatments. And many cancer patients now, even after the development of advanced disease, have multiple courses of chemotherapy. So what does that translate into numbers? We have seen about a 35% increase year over year in the intravenous chemotherapy program called the New Drug Funding Program. Just to give you some numbers, this year we spent $176 million. By 2012, we estimate that to be $446 million.
Thank you very much for the opportunity to participate. I just want to remind everyone of the timelines before I give you a quick update on the progress. So Bill 102, or affectionately known as the Transparent Drug System for Patients Act, was tabled in April of '06. It was passed in June of '06 and came into force in October of '06. There was an executive officer appointed until about June of last year, at which time then I was appointed to this role. Since I've actually just submitted my annual report to the minister and expect it to be made public within 30 days, as is prescribed in the legislation, but I'll just give you some of the highlights in terms of where we are with our progress. So in the fiscal year of 07-08, which would have taken us up to the end of March of this year, we did actually achieve savings of $260 million which were reinvested into the system. That was a commitment made by the government that the savings that we did achieve, we would go directly back into the drug program. We also managed to get the growth rate down to around 5%, which came down from 10% in 04-05. That was also one of the major goals. There are a number of factors that went into us being able to lower that growth rate. We also listed 142 individual drug products that would brand drug products, excuse me, that would include doses and strengths. And if you extrapolate that into, or count the generics rather, with the brands, it's around 350 new products. So there was a tremendous amount of work into, first of all, trying to take some of the drugs from the Section 8 and moving them over, but also just using this new mechanism, which Carol actually mentioned, the conditional listing, to try to really negotiate a lot of new agreements.
To the patient living at home. Please welcome Sahar.
Thank you. That was certainly encouraging. That's really good to know. First of all, thank you very much for the opportunity to speak to you in this discussion. As the Director of Pharmacy for Bayshore Specialty RX, a provider of home infusion therapy under contract with various community care access centers, or CCACs, I feel I am obligated to bring to you some issues that are affecting our home care program. For those of you who might not be familiar with the program, allow me to explain briefly. Ontarians are eligible for home care regardless of age, social disposition, or financial status. This means any citizen can attend at a physician's office or hospital, for example, and be referred for in-home services that may include their IV medications. Contracted infusion pharmacies play a very important role in facilitating the early discharge from hospital, reducing not only obvious cost per weighted case for the hospital, but also reducing bed use and overcrowded emergency departments. More importantly, home infusion helps avoid and or decrease factors like hospital-acquired infections, such as the recently widely publicized C. difficile. Statistics show Ontarians prefer to receive home care rather than going to a hospital or institution. Hence, one of our mandates as an infusion pharmacy, in partnership with the CCACs, is to get the patients out of the hospital.